watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Let's move on to the full facelift. What defines a full facelift? I mean, what is being addressed? The neck, the jowls, what is it?
All of the above. A full facelift pretty much addresses the aging of the face from the cheekbones down, below the lower lids. In that area, we lift the mid-face, which is the cheek area, bring it up fairly straight up in a vertical direction. So we're trying to, again, reverse aging vectors. We're trying to reverse what gravity has done to this looser tissue now that is a function of aging, and bring it back up from where it started. So mid-face up, jawline, jowl area, back and up, neck, back. Address skin, tighten skin, address the fat layer. Most of us have a little bit of heaviness underneath the chin area that we also thin out in a facelift. The muscles separate, so we sew the muscles back together underneath the chin. And then try to bring everything up in a natural composite fashion. Skin, fat, deeper tissues. Everything goes down, it goes up in the direction that it came from.
Now, what do you say to a surgeon, and I've had a surgeon on the show that said he just pulls skin most of the time, just back.
Okay.
What's your response to that?
I don't believe that that really works well, and it does not have good longevity. There are a lot of surgeons that do that, and they get results, but I'm not sure their results.
Is it training? It's just a difference in training?
It's training, it's experience, it's their own way of approaching things. You have to be comfortable with what you do, and I think that some surgeons tend not to continue to learn, continue to evolve, continue to improve their procedures. They become comfortable with one operation that they do, and that's what they do over and over again. I think there's probably a positive to that, in that if they're doing something over again, they probably are doing it fairly well, but that doesn't necessarily mean that's the right operation. Because you're doing the wrong operation over and over again, that isn't necessarily always justified.
Can you mention the underlying tissues? I guess the face ages, you've got the skin, and then you've got the muscles underneath that sag, and then the skin itself, addressing the skin. The underlying tissues, what do you do there in the facelift?
In a facelift, the deeper tissues are actually the strong layer. It's called the SMAS layer. The SMAS layer is a vestigial muscle layer that is fairly well continuous from the cheekbones into the neck. In the neck, we have the platysma muscle, which we talked about tightening in the midline in the neck. Over the jawbone, that platysma muscle becomes the SMAS layer, which is a really strong fascial layer. Fascial is that kind of whitish, strong tissue that's in muscle. And we release ligaments that hold that to the hard tissue, that being the bone of the face, and then bring that up. That's where the deeper, tight, strong sutures are. The skin is then redraped over that, and the fat layer is brought up along with that as well.
What about incisions? Where do you hide those? Because it seems that that differs surgeon to surgeon as well. Some in front of the ear, in the ear, behind the ear. What about yours?
Incisions all have to be camouflaged within normal tissue lines. And everyone that has a facelift pretty much has to have an incision in front of the ear. And the closer you can get to the ear, the less conspicuous that incision is. In males, you have to have a special technique to minimize bringing the bearded skin back too far towards the ear. The incision goes up a little bit above the ear, and then it goes typically around the earlobe and back behind, and then back into the scalp again. What I've tried to do is to limit that incision from behind the ear back into the scalp. This is the most conspicuous scar that you'll see. And I think in the average person that has a facelift that doesn't have a really fat, heavy, loose neck, you can avoid that incision. And if you can avoid that incision, then you've gone a long ways towards minimizing scars and minimizing visibility of those scars.